Hey everybody, welcome to Everyday Health Hacker. I'm Mike Herzing. The show's coming to you right here from the Meridian Health Institute in Sugar Land, Texas. Great place, Sugar Land, Texas,
yes.
Isn't it? It's awesome. Everyday Health Hacker right here is the brainchild of Dr. Lisa Liao. This is not either one of these is Dr. Lisa Liao. She's right back there in the background, and she is Meridian's Chief Medical Officer. But last week, we talked about stress and how it affects the body and how many problems start in the mouth. Oh my gosh. My mother used to say, wash that mouth out. But either way, there was a whole different reason. But we promised to visit with the staff right here at Meridian. We've got part of them here. And we're going to follow up on that promise because we have Adriana Solis and Eddie Valvaneda right here. They're going to slow them down just long enough. We're using their lunch hour. Okay, we promised to get back to work, Lisa. We promised we're going to get back to work. But let's talk about some of the problems that start in the mouth. And let's start first by what you guys do for us.
Okay. Hi, I'm Adriana Solis, and I am the director here of patient care. I take care of making sure that your schedules are set with the doctors, go over all of your treatment plans, financials, all of those good things. Yeah. Answer any of your questions that you might have for your treatment. She does
everything they ask her to do.
I wear a little hat.
Now Eddie here is our camera and lighting guy, but I know you do something else too, besides wear Dr. Fold's outfits, shirts.
Well, as you said, my name's Eddie, and I am the lead assistant here. I do a lot of other things too, as Mr. Mike said. You know, I run a lot of the audio and visual here in the office when we do the podcast. But I stay in the back. The back is my home back there, so I'm back there.
Yeah, he's a little bit nervous, but this guy is awesome. Both of these are awesome. But guys, y'all do a lot of work with the clear aligners.
Yes.
That I wear, which is actually sitting out in the car. I've left it inside the car right now. But tell us how successful that's been, and what are you hearing from your customers, your patients?
You know, clear aligner therapy is a great way to have a beautiful, healthy smile. The technology that we use with the clear aligners through Misaligned makes it easy for the patients to have really what the results they're looking for. And it makes it very effective. People even lose weight on them when you wear them.
Wait a minute. I want my money back. No, I'm just kidding. I haven't lost enough weight yet. I've lost some, but there you go. What about you, Ed? What do you hear? Because you actually worked with mine.
We have some technology that we can scan a patient's mouth and it will give you like their bite. It'll show you the before and afters. And but a lot of patients, they really like that they can take the clear aligners and it's not braces. They don't have metal braces where it's hard to keep their teeth to keep it clean.
Right.
So with the clear aligners, you can take them in and out. If you do a social event, you know, if you're speaking in front of people, you can take them in and out. And so that's probably one of the greater benefits and a reward that patients like when it comes to clear aligners versus your traditional metal braces.
Well, nobody noticed you're wearing it.
Absolutely.
Okay, and there's certain times I can actually talk with them most of the time. But if I'm on the air, I normally take them out. But normally, all the rest of the day I'll leave them in. You know, I take them out, clean them up, and everything. And then in the morning, because my biggest thing is I'll go to I just clench all the time.
Right.
And you guys always yell at me about, "God, you've been clenching up." So we have these clear aligners. I'll wear them out eventually, and I'll give me another set. And they're just so handy. They're just you don't even notice they're there. Which is kind of people going, how do you not notice it? You don't. It's very simple. But we've had such a stressful year. You know, I don't remember 2020 was as bad as 9/11 when we didn't know what was going to happen.
Yes.
You know, same thing. We didn't know what was going to go on. And have you seen a lot of the oral, facial, and all the jaw pain? You've seen a lot more of that? Well,
yes,
you have patients coming in with complaining like that?
Absolutely. And a lot of that has to do with the clenching and the grinding that we do during the day. We lead stressful lives, and with COVID, we've had a double hit of stress.
Yeah.
So with the aligner therapy technology that we use, it's there to help better protect your teeth. So we don't find a lot of people that are breaking teeth anymore with this technology. And go ahead, Eddie.
And so when you're with the clenching and the bruxing is another word, or grinding, there's a lot of terms. But when you wear something that's in between the teeth,
Right.
it's opening up the joint, and it's not enamel on enamel,
Mhm.
and so I explain it to patients sometimes. It'd be like if I did like this to you all day, Mike,
All day.
and I kept doing this, and a day goes by, and a week goes by.
Right.
Well, after a while, it's going to start to hurt.
Yeah.
You know, and it doesn't hurt now, but after a while, it's going to start to bruise. So it's the same thing. It's, you know, it's you're bruising the joint. You know, it's making it sore, and that's what causes, you know, the tension, the headaches, the neck pain. You know, down the back. You know.
Oh, give me a massage.
So, you know, wearing, you know, clear aligners, it helps, you know, also not only will it, you know, cosmetically align your teeth, but it also wants to protect and save the joint.
You know, there's a lot of people snore and things like that. But I've also noticed gum infections. How about, like, I remember breaking some of the porcelain outsides of my crowns,
Right.
just crushing them.
Right.
And then I was like, I keep doing this. What's wrong? And then that was before these aligners, and that they've been really, they've solved most of my problems like that. I sleep better. I'm starting to get a little bit of relief from my tinnitus a little bit.
Mm-hmm.
And so, folks, I mean, when you wake up and your teeth are a little loose and this kind of stuff because you've been doing that, you don't know you're doing it, do you?
You don't. And really, with when we have poorly aligned teeth, that's when we find that bacteria is creeping up in those areas.
Okay.
It's hard for you to brush. It's hard for you to floss. So with the clear aligner therapy, we're able to realign things where things fit correctly in the mouth. When things fit correctly, that's when we have a better health. It's better for our health.
Oh, so it's supposed to fit together
it's supposed
correctly?
To fit together correctly.
Oh man, I knew
Absolutely.
there was some kind of problem there, because it seems like I ground my teeth and, you know, halfway down and things like that.
Exactly.
And then now I find out about you guys. I mean, kind of, where were you 20 years ago?
Right here.
Right here.
Right here. Then, you know, the funny part
Right
is,
here.
they
Right
were.
here.
I wasn't here. I wasn't here. That was it's my fault. There we go. I always say it, guys. There's a whole lot more of this, but and when you get these gum infections and things like that, I mean, yeah, I've seen people that wake up and they'll brush their teeth and it's like, my gums are bleeding, and it's like, why is that? And it's true. Why do they do that?
And again, it goes back to the poor alignment that we have.
Okay.
If we have poor alignment, that's when we find that we have more stress caused to the teeth, to the jaws.
So it's almost like which came first, the chicken or the egg?
The
alignment caused by the stress, or the stress caused by the alignment?
There's all of those combinations that come together and really form the perfect storm, if you will, in the mouth.
Okay.
And then what happens there, Mike, it also leads to other health issues. That's where we can find a lot of people that will come in. The same kind of tartar that's found in our mouth is the same kind of tartar that's found in our heart. So when you put those two slides under a microscope, you can't tell whether it's coming from the mouth or whether it's coming from the heart. So those are really good things. Bleedy gums especially are good opportunities for you to get into your doctor. We have a wonderful doctor here, Dr. Duncan Folds. We have wonderful hygienists that are able to help you get back on track.
And so to reiterate, as she was saying, when you have teeth that are in malocclusion, like they're crooked, you know, it's
He's using big words here, and it
He's
works.
using big
I'm trying to sound
I'm
sophisticated.
impressed.
But when you have teeth that are in malocclusion,
Right.
like she said, that's where bacteria just finds places to sit and hide. Because teeth they're not straight, they're not aligned. So then that starts adding a whole new ball game. You know, gum recession, you know, bad breath, and you know, bone loss. I mean, that's a whole nother topic. But you know, when you put your teeth in alignment and everything is, you know, straight, then that's when you start preventing all this other stuff, which, you know, the bacteria, the clenching, and then, you know, the stress levels will decline.
I remember the days where they just went, oh, you know, you have some teeth problems. Let's just pull them out and go with some kind of dentures. And I'm like, come on. I mean, save what you have. But that's what people used to do.
Absolutely, and think about it. That's amputation. That's absolutely an amputation. That's no different than amputating a foot or a leg or any other body part. So we need all of our body parts to function correctly, and we need the alignment of our teeth to last us a lifetime. So when we have those things come in harmony, then you have happy patients. And
I had actually had a cracked tooth because of stress. Ended up having to pull that one
Exactly.
tooth because it was cracked all the way down.
Yeah.
And so that was all stress, you know, running my own business and
Right.
doing all the stuff. And just, you know, I should have been able to handle it. Okay. But we don't know. And there's certain things. I went to my doctor and he pointed to the dentist and the dentist pointed to the doctor, and it was kind of in between
Mhm.
and was playing little,
And then
you
you
know,
met us.
and then I met you. This was way before you guys. I think you're in elementary school then. But all this kind of stuff happens, and where they all point at each other. But the cool thing about coming here is you work together.
Absolutely,
Yes.
absolutely. And absolutely, there's a beautiful harmony here with Dr. Folds and Dr. Liao working very harmoniously together. And definitely a systemic link between the whole body, right? And that's what we really absolutely treat.
Yeah, they go home and talk about us and like, what do you think about this? What do you think about that? And she's over there laughing because it's true. Isn't it? I can see. Come on, Doc. I mean, you're making us crazy here, but no, it's really, we got to talk about this more. Can y'all come back
Absolutely,
in next
we'd
week?
love to.
Yes.
And we're
We'd
going to
love
do that. So, folks, we're gonna continue this on in the next episode. So, anyway, if you have any topics you would like us to handle, info@everydayhealthhacker.com. Even if you say Everyday Health Hackers, we'll still get it. Everything is fine. And that was great, guys. Really, thanks for coming in, Eddie, Adriana. Really appreciate it. And folks, on behalf of Dr. Lisa Liao, the great staff here, these guys right here, and more. There's more of them in here. Our producer Jack McCraw is over here. I want to thank everybody for listening and watching. And please subscribe if you can, because we really appreciate it. Look for us on social media, on our website, everydayhealthhacker.com. As I've already said, I'm Mike Herzing. Have a great week.
Bye.
11 minutes.